Module 4, Previewing Questions. Do you have an active patient and family advisory council that participates in your organization's improvement efforts? Does your patient and family advisory council help guide quality improvement interventions and patient education? How often does this advisory committee report directly to the board?
Patients can improve quality in so many ways. Hospital boards are now working with what we consider patient advisory committees, and those committee members are made up of patients, their families, and community leaders. And it's important for them to be able to have access to the board so the board can hear exactly where process improvements can be better established, and also if we are meeting those end goals that most hospitals are trying to establish to make sure quality scores are what they need to be.
I think the patient narrative is so critical. Patients will tell you how you're doing. They are really our customer, and they know when service is not where it needs to be or when there's concerns around quality or safety. So much of healthcare right now is about trust, and so being able to trust the people that you're working with or that are caring for you is so critical.
Sometimes as a board member, your most important role is listening to what people say to you in the community at the grocery store when they say, aren't you on this board or that board? And let me tell you what happened. You know, we like to view ourselves, I think, as the experts, as the clinicians or the leadership within a healthcare system. I think the real experts are the people we care for. We always talk about how to educate our patients and their families and the communities. We need to know more about them educating us.
When you talk about equity and diversity, the board really should reflect the equity and diversity within your organization and the communities you serve. And so having a patient or family member on the board that represents the community is really that next step. From an operational perspective, it's going to take a lot of courage to do that, but I think that many organizations are coming there, are really looking at this as the next phase of how to make sustainable healthcare in the next future. The patient is first, the patient is last, and the patient is always. So if you put that into context, it's easy to make decisions.
The experience of being a patient is very different than the experience of working inside of healthcare. We're all in the same arena, we're all in the same world, but at the same time it's very separate. And you can't understand the internal world of a patient if you don't go directly to that patient to learn more about what they're feeling, thinking, experiencing, worrying about. A huge component of patient and family engagement that we don't typically talk about or we don't talk about enough is patient activation. So when a patient becomes activated in their care, and that's something that we can measure and it's something that we can move, when a patient becomes activated in their care, they're going to be more adherent, they're going to have a level of knowledge and skills and confidence in their ability to manage their health and their health care.
Whenever you have a near miss or a serious safety event, it's important for all the staff members to come together to figure out how you can prevent that in the future. I would also say it's important to have a patient family's voice on those serious safety event root cause analyses. Hearing from that patient family's perspective is so important because sometimes we're always looking through the lens of the clinician, but having that family member there to remind us, don't forget about the patient and family's lens, I think is a really important piece. First of all, if you don't have a committee that's focusing on the patient and family, to start one. If you do have one, I would really broaden it so that you're hearing from the staff members and not just senior leadership. It's the staff members in the trenches who really know most about what's going on with the patients and families. Their voice is very important. Families are the first ones who will tell you what's wrong in your organization. They're also the ones who will tell you how you can get better. So having that voice is so very important to any improvement that's going to be sought.
So start small, get the organization to trust and see the value in it, and then build from there. These programs don't get built overnight. They take a sustained effort, but just get started at start small and grow it. I'd really like to see hospitals embrace advisors, invest in them, provide the training, provide the context. The more context we have, the more effective we're going to be. And so by doing that and growing your programs over time, I really want to see our hospitals get to that last patient-family engagement metric of having advisors on their governing boards. My preference would always be to have an advisor sitting as a full member of the board. But again, those can be incremental steps. We don't have to jump forward with that. I think the critical part is to really appropriately prepare the advisors to be a full partner, full member of the board. And as I said, that can happen in incremental steps, but I think having that unique perspective of a patient-family advisor provides the board critical information about what it really is like to be a patient and family member in that hospital.
So I think that there's a need for more strategies and more innovation. I think the other huge need in the field for patient and family engagement is a return on investment. Is really to talk about what are you getting beyond the stories. The stories are phenomenal, but it's moving from patient and family engagement as an ideal to patient and family engagement as a strategy. Moving into operations, taking what the patients and family members say and what you hear in Patient and Family Advisory Council and actually moving it into action.
Have a solid charter, have solid rules of engagement, if you will, so that you're building that trust and at the same time building that transparency. I think it's really a lot to expect our hospital leadership to jump in with both feet to transparency without having that foundation set. Providing that kind of information before an advisor enters the room really helps them to provide value and impact to the room. And that's what we really want, is the patient and family voice at the board table to have impact and to bring value to the hospital's decisions, to their improvement efforts, again, as a strategy for improvement. I would encourage, again, hospitals to be intentional and thoughtful in their recruitment of advisors. So move away from the idea of, we're going to ask our physician staff to identify some folks that they think would be good. And we want to get to folks who are self-motivated, are really excited to be in this partnership with you. And so we can do that better by creating a wide net for recruitment and then using interviews and applications and other techniques to ensure that we're getting to folks who are self-motivated and intrinsically motivated to help make the hospital better. We understand what their motivations are coming in, and so to do that work up front, while it takes longer and takes more effort, I think after the honeymoon period is over, 3 and 6 months down the road, it really results in a more robust council.
At the end of the day, the board can only be as effective as the true picture of that healthcare or that hospital's experience really is. Every day, there are real patients and families going through that hospital and that health system. And until the board is in touch with that real, authentic patient experience, they're limited in their ability to be effective when it comes to quality, safety, and satisfaction. Our leaders are absolutely 100% essential. Our boards, our trustees, absolutely 100% essential in saying this has to be our priority and we have to keep it as a focus and we have to continue to push through the challenges and make this a cultural shift that is sustainable.
Hospital or healthcare system now that doesn't fully engage patients, families, and their communities in their care is missing probably the golden opportunity, because again, it is care that we provide that is the essence of our product, and that's what we do. We can't always assume that we are the experts at this, so we are at a loss of information, of valuable information, by not engaging our communities and our patients and families.
Key takeaways. The patient voice must be heard in the boardroom. Hearing from patient and family advisors must be a regular part of board meetings. Patients and families can offer important insights about the care process and identify opportunities for interventions and process improvement. Patient, family, and community advisors can be used to test educational materials and improve practices and services both within the hospital and community.